Brandy, were you able to record?
Now we're recording.
Ah,
Hi,
I
good
was,
morning, everybody. We have a long agenda today, so and such. So, okay, James, you want to move it up to next one?
yeah.
The question to all y'all is, what is your favorite holiday beverage? And when you answer the question, please let us all know what agency that you are from or working for. Um, my name's George Adams. I'm the co-chair with Maria. And my favorite beverage would have to be hot chocolate, sitting in front of a fire and enjoying relaxing time. And I'm in Medford, Oregon, Jackson County, Southern Oregon. And I'm going to pass it on to Vanessa.
Hi, good morning, everybody. My favorite beverage is champurrado, and I cover Coos Curry, Coastal Douglas, but I reside in Philadelphia. And I'll pass it to Veronica.
Good morning. I am the business analyst for the Oregon One mobile app. My favorite holiday beverage will also be a hot chocolate after a snow day. And I will pass it on to James.
Hello, yes, James Barda. I am the engagement strategies coordinator with Oregon Eligibility Partnership and happy to be here. I suppose I don't want to have very much of it, but it's hard to resist eggnog. And maybe once in a while I'll sneak some extra additives into it too. I'll pass it to Susan.
Community Health Centers of Lane County, and I would say Champorado also. And I'm, has George gone yet? I can't remember.
Yep.
Um, Whoever hasn't gone next.
I can go. Andrew Demaray, one online portal BA, business analyst, and I'd say I'm gonna go with kind of the crowd here, and hot chocolate or like a mocha if I want some caffeine, and I like in the holidays a little bit of like peppermint in that, so chocolate peppermint. And let's see, who else do we have today? April, have you gone yet? April Paul?
Sorry, my computer is not clicking. Yeah, April Paul, Neighbor Impact Tracker Resources over in Central Oregon. I would have to say just like general winter time is like a hot toddy or a mulled wine because I just want to be cozy. And I drink copious amounts of coffee all year long. So I will popcorn Maria.
Hello, good morning. Maria Park, Senior Program Manager at Asian Health and Service Center, co-chair here with George. And my favorite holiday beverage is this like Korean hot cinnamon kind of tea with dates. Yeah, and also hot chocolate with lots of marshmallows. Okay, who hasn't gone yet? Let's see here. How about Christy?
I am Christy Reese, she, her pronouns. I'm the executive director at FACT Oregon, supporting families experiencing disability. And I think between a hot chocolate, I also love hot apple cider. So enjoying that. And I will pass it to Brandy.
Hi, everyone. Brandy Strom with the Maslow Project here in Josephine County. I'm a case manager and team lead, and I'm going to say hot apple cider and hot chocolate are my favorites. And then let's see, who else hasn't gone? I haven't been keeping track, so someone who hasn't gone.
I can go. Sydney Borchers from Neighbor Impact Childcare Resources in Central Oregon. I'm definitely a sucker for anything hot, hot chocolate, hot toddy, tea, literally anything that can warm my hands. Um, Gosh, this is really testing me. Dion, did you go?
Oh, not yet. Thanks. Dion Destin. I am the executive assistant for Jillian Johnson, our sponsor. I think for me, and I apologize, I'm off camera today. I'm still a little under the weather. My favorite holiday beverage, I'd have to go with I do enjoy a nice hot cider or the eggnog. And as James so eloquently added, with additives, with or without. So. And I'll kick it over to NJ.
Hi, Inje, Community Program Coordinator with Asian Health and Service Center. Red wine. Okay, and let's see who hasn't gone. Maybe I'm the last one.
We just had Vixen join us.
Sorry, I was late. It's open enrollment time. It's crazy.
So just a quick introduction, and what is your favorite holiday beverage?
I'm Vixen Radford Wex, and I work for Northeast Oregon Network in Wallowa County, and I'm an outreach and enrollment assister and community health worker. My favorite holiday beverage, I just really like hot chocolate, Susan. I don't really do coffee or anything, but I do love hot chocolate.
Okay, so we have Sydney and we have Brandy Arthur still. Brandy Arthur?
Yeah, I'm gonna go with the consensus of hot chocolate, but I also like additives in mine, specifically bourbon.
Way to call it out.
Okay, Sydney?
I already went, and I might have been the last. I'm not sure.
Okay, and then we have an OR old 232792. Who's that one?
That's Andrew, who looked like he had a guest and went off camera, which is unfortunate because we were just about to go through the recap. Oh, there he is.
Sorry, I'm here. Our TMI, but my washer machine sits next to me. It's my coworker, and it's leaking a little bit of water. So my wife was wondering what the heck is going on. So apologies for that.
Did Dion already go?
I did, yes, thanks.
Oh, did Veronica go yet? Sure.
Yeah, she did. Everybody's went already. Okay, who's up for this 800-363? That would be.
That's me. Yeah, I'll do the recap here. So 800-363, that's the self-scheduling change request that we put in as part of this work group. We went through the joint design process and got pretty far along in that, and then unfortunately, this work has been put on hold. So we're dealing with a lot of different changes from the HR1 bill, from a thing called Snap Per, which is like Snap, like an accuracy project around Snap. So there's not a lot of space on our timeline, and there's also a different scheduling change request going in. I won't go too much into that, but it's known as on-demand scheduling. And there are some conflicts between that and the work that we did in this. So as of right now, this work has been put on hold. We're hoping that all of the work that we put into this can at some point be put back on the timeline, but that's kind of where that HR1 and Snap accuracy stuff comes into play. Like I said, there's not a whole lot of space. So really unfortunate, honestly, to give this news, because I know we did, I thought this was a great idea. We put a lot of work into it. Both Maria and NJ spent time with us to make sure the voices from this committee were heard on this. So like I said, hopefully we can get the work that we did on this input into the system at some point, and once we know more about that, we will. But as of right now, this change is not going to go into the system. So for request 77, clarify how to report a change about household member leaving. Part one has been input and completed on October 8th. Part two is scheduled for the February build. We are still working with policy areas on some getting final approval for that one. So yeah, we can move on to the next page. Request 80 is updating document upload guidance language in the ONE Online portal, scheduled for the February build. That one is on track as far as I know. And create a request 81, create a user-friendly password reset link sent in the email, also scheduled for February 26 build, and that is on track. And that's February 2026. I believe it's early February that the actual build will be, just to clarify.
All right. Well, any questions on these past things? Still in the process?
Yeah, James, this is George. On the guidance language, could you explain to the group what we went over on that, on the guidance language? Is that the one that had different type of languages on the online portal?
No, it's more there's a page where you upload documents to the ONE Online portal. It was like the language around how we describe like the process of uploading a document. So it's not different languages. Just looking at the language on screen, kind of the instructional language given to folks when they're uploading documents.
Oh, that's right. Okay.
Yeah, everything is a bit further away since it's been 2 months since we last met.
Okay, well,
yeah.
My question is, could people on their phones do this now? Or do they have to do it through a computer still?
No, the mobile app has a document upload feature as well. It's actually, I would say for folks who have an online account and have a mobile device to use, that would be kind of the easiest way to do it, because it has a built-in like photo option in there where you can just like take a picture and upload it directly from your phone for whatever you're uploading without having to, upload that file to your computer first or whatever. It's a little bit more direct. So it's pretty easy to use from mobile.
Okay, and while we're on the subject, another question I want to bring up. James, did you tell the group here? I know you told me about that now the pictures have to be on the new accounts for like passport IDs, driver's license and all that has to be on the accounts now?
That's different change request that is coming.
Okay.
Not sure when, and Vanessa has been part of some of that work.
That is currently scheduled for July of next year. And George, that change is specifically for the remote identity proofing process. It's a one-time thing that every user goes while they're setting up their account.
Okay, well, when we get down to there, I have another question for that. When we get down to where we're going to go with that.
I'm not sure we were going to talk about that as part of this meeting. So if you have a question, now might be a good time for it.
Okay, well, something was brought up to me, which I never thought of before. And I have an employee that says that now his picture is taken already when he applied for the ONE system here in Medford for the new account. So I guess they're already doing it down here in Medford. A question that did come up, and that was, what if a consumer has a care provider that was to go out and get groceries for them, but the consumer was so disabled that they couldn't go to the store, but the caregiver could go to the store for them. How would that work if the picture has to be in the account?
So I think there's a little bit of misunderstanding happening here. So we're not asking folks that they'll like upload a photo that's attached to their account in any way that is like needed to like associate that person is the person using their benefits or anything like that, which it sounds like maybe what you're getting at. It's when you set up your account for the first time, we use that photo ID and it used that to verify your identity for a single time. And then that photo is not in any way like associated permanently to your account. So to get at your actual question, sounds like a person who would have an authorized representative or an authorized payee. That's not going to affect that process at all. So once the account is set up and everything is good to go, you don't need to like verify that photo every time you use your benefits or anything like that. And then I also want to call out that, it's while that is going to be the quickest and easiest way for folks who have a photo ID to verify their identity, they can still go through the manual process of calling the tech team and having that their ID verified manually that way.
Okay, and is there any chance at all that you guys would be putting photos on food stamp cards? Because I know the state of Michigan has already made a law and they've already put pictures on people's food stamp cards. Will you guys be doing that here soon?
I've not heard of any plan to do that in Oregon. That is not in any way associated with the RIDP change request.
Well, thank you for clarifying.
Cool. Well, we're going to dive into the Let's Get Started page. I'm going to stop sharing the presentation so we can move over to the briefing sheet. And this is this is a bit where we are looking at the page that everyone comes through when they start up their account, when they're looking at applying online, things like that. And so what I'm sharing right now is what the beginning of the page, what it looks like right now. And Veronica, I think you kindly redid a lot of these pages for the discussion 2 months ago. So
yeah, if it's easier for the group, I can also screen share and show you guys what the page looks like again in the actual environment, because it's kind of hard to see on the briefing sheet with the 3 different chunks.
Yeah, that's probably better if you have that set up. Why not?
Yeah, sure. I will turn off my camera though, just so my internet, I don't freeze up. And let me figure out how to screen share and Zoom.
But as Veronica's doing that, just a reminder that we had information about the different programs you can apply for, but often people were confused. They would click on the programs thinking the links for the programs thinking that they were applying for them. But once we opened up the discussion on this Let's Get Started page, there was some requests for other changes.
Okay, I think I'm doing this right. Can you guys see my screen? Was that a yes?
Yes, that is.
Okay.
I was wondering, is that look good for everyone?
Yes.
Okay, awesome. It's weird, like Teams will outline the screen that you're presenting and Zoom doesn't do that. So, okay, so I zoomed in on the page here, but this is the first page that every user sees when they begin a new application through their online account. So it's super long. To recap the background for this request, the original ask was to edit this a sentence here or add a sentence to this little blurb here to direct users to scroll all the way down to begin their application. The confusion was that folks just saw the links listed here and thought, oh, I need to apply for daycare. So they were just clicking here thinking that's how they start their application, when they actually needed to scroll all the way down here and click accept to proceed with the application. So the original ask was to add some wording in here to direct users to scroll all the way down. And in the last meeting, we kind of ended up with redoing this whole screen. So the group back in October had asked to move all of these links here, this whole section here, to the following screen. You guys requested page breaks to be added and then to shorten and remove like as much text as possible off of the screen. So I will share a mock-up of what I was able to remove. So we moved all of the links to the following page. The SNAP benefits I reworded to make it a little shorter. And then I tried to make this paragraph a little shorter. But this paragraph in lower, we cannot make any edits to it. We can't remove it and we can't reword it. That has to stay for legal reasons. So that's what it looks like now. I'm going to zoom out. It is quite a bit shortened. And if the group wanted to, we could also move this paragraph here about community partners to the community partner screen in applicant portal. So it would make this page here a little bit shorter as well. I do have mock-up screenshots of the following screen where I moved all of those program links to that I can share, but I'm going to pause real quick for any questions.
Yes, Veronica, this is George again. Where it reads community partner website, do anybody tap into that and they would be coming up with links of all the community partners? Is how that's set up?
Yeah, it's a search feature where they can go and search for CPs in their area. There's already an existing page in the account where the user can go and search for a partner and associate a partner to themselves. So this paragraph would be very fitting on that screen if we wanted to go that route. But we can also leave it here if you guys think it would be helpful for users to see it at the beginning of their application.
So what do you think, guys? Maria, what do you think?
Oh, I put in chat. It seems more organized and especially like with the links moved makes more sense. So thank you.
Yep, and the page breaks in there I think help a lot as well.
This is Vixen. I think the page breaks will make it so people can read it and process better.
Randy Arthur, what do you think?
This is Christy. If I could jump in on the top in the community partners across Oregon, can you make any dot points there instead of just having the long paragraph?
Like break it up into.
So you could put the community partners across Oregon, who can help apply. It's free. They have been trained to answer your questions, and then you can like dot point. They've been trained to answer your questions. You can meet them in person or over the phone, and you can find them by going to this page. It's just that dot points can help lower your reading level and make it easier for people it's easier for people to digest.
Yeah, no, I agree. We can definitely do that. It would make the page a little bit longer. But if that's not a concern for the group, then yeah, I can definitely look at doing that. Or if the team votes to move this blurb to the CP screen, I could break it up into points on that screen as well. So whichever direction you guys want to move to.
Yes, I'm sorry. A dot point is a bullet point.
Thank you.
Randy, Arthur, what do you think?
I don't have any notes for this section.
Okay, Susan, what do you think?
I agree with the rest of the people. I like the page breaks and the when it says SNAP and medical, so you know what the section's talking about.
Okay, April, what do you think?
Yeah, I like the page breaks. I like bullet points. Sounds beautiful.
Vanessa?
Sounds good.
Randy Strum?
That sounds good to me as well.
And Sydney?
Veronica, are you able to show us that community partner page or that section, sorry?
The section, like this paragraph or that screen?
That other screen you said that
Section,
maybe
yeah.
we could add the bullet points to. Oh.
So this is actually a mock-up of what it would look like if we move that paragraph to the screen. Currently, that section is just empty after this sentence here, so similar to the representative section, unless there's an actual CP linked. If there's a CP link to the case, then that information will display here.
Oh, okay, I see. Okay, thank you.
And we could do the bullet points here as well if that's what the group wanted.
Well, it would seem to me, and this is George, just by putting what you just put out there and then tapping into the website to get the whole list on the other side, that would make it, would seem to me, faster and easier to search that way than the first page being too long. Because then if you get the page too long, people are going to end up being bored and they'll end up sleeping while they're reading it. So did you get your answer, Veronica?
I think I heard input from you that you would want to shorten the let's get started page and add this paragraph here. I don't know if anybody else has thoughts on that. And then I heard that you guys want to break this down into bullet points. So I've got that down. I just need to know which screen do you guys want it on?
Okay, guys, do you want the bullet points after they tap into the website that brings into the bullet points or before? Everybody's saying first screen.
Alrighty, that's what I'm seeing in chat as well. So we'll leave it on let's get started page.
So with that being said, would that make the first page too long? I'm trying.
Well, I think we were able to get this first page quite a bit shortened. So I don't think that it'll really make that much of a difference if we leave it here and put the bullet points. It'll be a little bit longer, but not a whole lot.
I'm just trying to wrap my, I think breaks, it won't make that much of a difference. Okay. I'm just trying to wrap my head around this. I think it'd be as long as the end of the application pages. Okay. I'll go with that then with them. So that would be fine.
All righty.
So now that wouldn't change the community partner webpage, right?
Sorry, George, what was that?
So that wouldn't change the community webpage when they tap into it, right?
Yeah, that would leave it the same.
Okay, good. Okay. Okay.
Okay, so last mock-up I have to show for you guys. Oh, wrong one. Unless it's still loading. Nope. This one. So this is the following screen where we moved all of the links to. Previously, the screen was just this portion, so everything above this page break. I've added the page break and then all of the links from the previous screen down below. With this sentence here, to learn more about each program, click the links below. So thoughts on here?
Yes, Sandra, go ahead.
So the first page listed the SNAP program, the medical, only 2 programs out of these 5 programs. But then second page list all these 5 programs. Is that because this application you can only apply for SNAP and medical? Or, right? Because the first, if we go back to the page before, it only lists the SNAP and medical.
Oh, you mean these 2 sections here?
Uh-huh.
These sections are only here because we need to provide more information specifically to those programs. We also need the link here for the short SNAP application.
Okay.
But you can apply for all of these programs.
Okay. Okay. Oh, I was just wondering. Because it seems like you should list it all. I don't know. Okay. And I'll also usually when you list things, usually you kind of do alphabet order, like cash assistance and then disaster employment. And so I'm always wondering why SNAP always come first, and then it's just I thought that's kind of strange for me, but I don't know. Maybe there's a reason for it.
Go ahead, Andrew.
Yeah, I don't know if there's a reason for the order in which we list the programs, and I don't think we're proposing on changing that necessarily. But a thought that I had for this is in regard to like the links below, maybe we could ask for those to be dynamic. So to like save, so if someone comes to this screen for the first time and they haven't applied for anything before, it would show, all of the options for them to apply for. But say they already have SNAP and cash assistance, and maybe we could hide the, they already, they're not applying for benefits for the first time. We could hide the links for those and it would save some space on the page. Also, like disaster SNAP's not always active in Oregon. And so we could, probably hide the help text for that one unless disaster snap is active and able to be selected. I don't know if that makes sense. It's just a thought I had.
Well, Maria down here says, can we change to if you would like to learn more about each program? Click on the links below and put it below the checkboxes. Andrew, that's what she reads.
And it seems a little repetitive on that next sentence again.
Maria, do you mean like put each link below each checkbox for the
No,
program?
no. So you know how on top it says, please share the programs you or people in your household would like to apply for. And then like that bolded sentence, like just move it below the check boxes. But then, like I said, it just looks like it's repetitive in the next sentence.
Guys, I have noticed when they pull the screens up, I have noticed that only food stamps and medical is on there, but I don't see state services on there. Is there a reason for that? There's no state services on here.
What do you mean by state services?
In the one system, you're not just doing medical and SNAP, but you're also doing state services. Signing up for state services with case managers. I thought there was all 3 subjects on here instead of 2. Unless
you mean like APD medical?
Yeah.
Yeah, that would just be considered medical assistance. So if we're not, you just apply for medical assistance, whether it's what would be, regular Medicaid, or if it's something that is through APD with a case manager, that is determined through the application process, but you don't apply for those as 2 separate types of benefits. It's all just considered medical assistance.
Oh. Okay. I misinterpreted then because I thought all 3 services were on this. State, medical, and SNAP. I thought medical was just when you pick a CCO and stuff, separate. It just sounds like I misinterpreted, I guess.
No, it's a good question, George. And I think it kind of is captured in the medical assistance has different links here. There's organ health plan, medical benefits for people who are age blind or disabled, and then medical benefits for refugees. So, based on the outcome of that application for medical assistance, there could be a number of different kinds of medical benefits that you would qualify for. But I think the reason it is this way is to not have someone have to make that determination on their own, like what they qualify for. So they just apply for medical assistance, and then based on what they put in the application, it determines what they're eligible for.
Okay.
The reason for my suggestion is mostly so like the top is just choose the program that you want to apply for, and then the bottom is to kind of learn more about that info. I think that's what I was trying to get at.
Okay, guys. So, Veronica, did you get your answer?
Sorry, George. I think we need to talk a little bit more about Maria, get to a decision on Maria's point here, because I think it's a good point. So what I'm hearing is the top section is specific to like what you're applying for, but it has this kind of bolded random section here that says to learn more about each program, click the links below. Do we want to remove that from this top section here and either add it to or just leave the text in the bottom section below the page break? I mean, do other people feel the same as Maria, that it's a little out of place in the top section, or does it make sense where it is?
I think that was the whole reason why we moved it from that very first page too. So
Vanessa, Brandy, Vixen, April, Susan, what do you all think? Anja?
This is Vixen. I'm gonna say that like for me, it doesn't really matter. Because like if I'm helping somebody, I can't do anything but medical assistance. Like my box only comes up for that. And so it doesn't matter how those look. Um, my thing is I'm still having issues that sometimes I can't go in and apply for something for somebody if they're already on a case with somebody, even if I report a change, that screen I can't get past.
The screen we're seeing now or the previous one?
No, like I have tried, like, say you and I are on an application together and you don't have coverage, but now like, you've lost coverage through your employer or something. And I'm going to try to, you know, a community partner is helping me go in and do this, like for the community partner or themselves can't get past that screen. Like I've tried to report a change that person now needs coverage. I've tried to apply for coverage and it just gives me that screen. I can't get past that. It just locks me there. And so I have to send it to the CP line to say, can you please apply for this person coverage? So I don't have that this screen works for me ever.
Yeah, and Vixen, I know you did send me some kind of background on that before. I don't really have a good answer for why it's not working right now, but I need to continue following up on that for you.
Well, and then the big question is for an individual who's going through this on their own, what do you think makes sense to?
I think for me, I would think it would be better if the like SNAP was in bold supplemental nutritional assistance program with the link below that, and then net cash assistance with the link below that. So it's just not so compartmentalized, like it's just under the actual program. Um,
So yeah, rather than having two sections, a top section, a bottom section, have the appropriate link below the checkbox for that program.
all right.
How do
Yeah.
people feel? Oh, sorry, Veronica, go ahead.
Yeah, just gonna add, if we go that route, we may want to think about adding some text in there so people know why there's a checkbox and then a link for the same thing.
Yeah, otherwise, I mean, I like Susan's idea or just switching applying the bottom section with the checkbox section. So then it's more of a greeting. And they can kind of click through and then go back to their application, hopefully in time before they get kicked out.
Vanessa, you were going to say something?
I think the verbiage is all jumbled up, to be honest. What are you applying for? Please choose the programs that you would like to apply for. To learn more, each program, click the link below. That shouldn't be there. That should be in that second checkbox, that second part. That then I think instead of that, you should have, are you applying benefits ODH for the first time? That should be there. Then having the clicks. And then that line to learn more, because it's all jumbled. It's like, for me, I'm like, wait, what are we doing? Are we clicking? Are we hitting links? I think to learn more for each click the links below, that should be in that second box. Because right now it's a hot diggity dog mess, to be honest.
Christy?
I think the more you can combine and take away words, I think makes it much more simple. I would agree that I guess if people are applying and they still need more information about the program they're applying for, it makes sense to have those links there. But anything you can do to combine and make it simple, I think is what benefits people the most.
Brandy Storm agrees with Vanessa and Chair and Christy. So what do we do? Okay. So Brandy, Arthur, what do you think?
Sorry, I had to find the mute button. It's different. I do like the links underneath the checkbox, but I do also really like the idea of the bottom section becoming the top so that they can know what they are applying for. So they can kind of click it, do the research, and then understand what what the checkboxes are.
Can I ask a question? May I ask a question? This is Christy. I'm trying to recall from the October meeting, were those links added because feedback was that people were going to apply for information and they didn't understand it? I'm wondering why the links were added, like what the purpose was before.
So links were not added, links were moved, and if we put them back to the top, we're going back to where we were. The links were at the top, and people were actually clicking the link, thinking that that's how they would apply. So they were being looped in circles. So if we put that back up to the top, we're going to go right back to the beginning.
So I understand that. What I'm trying to understand though is the reason that those links need to be there for information. Are people going to this site to apply for benefits and not know, and they don't know what to apply for? Is that why we have those links at all in the application process?
I think that, but also they might know that they need medical assistance, and then they get to this screen here with these links and they're like, oh, what's SNAP? I didn't know I could, get benefits for SNAP, or I didn't know there was a program for childcare. So also to bring awareness that there are multiple types of different programs that they can apply for all in one go.
Marie,
is there feedback for how many people are doing this without the support of someone else who would have those questions? I guess I'm just trying to figure out if this was feedback from the community that provided that information, or are we trying to think ahead of time?
I think it's feedback we got, and APTT folks, correct me if I'm wrong. I think this came from our tech team getting calls from individuals who are getting stuck and unable to get through the application because they kept clicking this. I don't know if that answers your question about like who needs this information when they come. But the actual like source of reorganizing this page and the links on the page were coming from.
Right. So I understand the reason for the reorganization. I'm just wondering why we need to have the links there at all. That's my question.
Do people have questions about the programs and click through these links? Is that a thing?
I mean, I guess personally, I think it's helpful, particularly for medical. Like George brought up earlier, like why isn't there different options for the different kinds of medical? I think this kind of gets at that a little bit in explaining what are the different kinds of medical you can apply for. I know from personal experience years ago when I applied for food stamps, SNAP benefits, in my younger life, I didn't know any of these other benefits could be applied for. So I kind of like leaned towards that. Like, I thought I was just going to a food stamp office. I didn't know you could request other kinds of benefits. So I think it is helpful in that way, um, kind of informing people of the other benefit options.
I know it's working at a storefront office. I know it's a question that comes up frequently enough where someone's applying for food and not realizing they can also apply for long-term care through medical. And so they're like, we'll also check this box. So I know it does happen in person. So I would assume it's probably a question that would also happen virtually. So to me, it would also make sense to have those links here.
I put a comment in chat. I don't know if we could just put like that little icon that shows more for more info. You click on the little icon, or like just put the link next to the, like supplemental SNAP, like, and then put the link next to that. And they can just click on it to learn more about it. Then we can really simplify this page.
Andrew, do you know if we can have clickable links in help text boxes?
I'm not sure. I haven't. I don't think I've seen that before, but it's worth exploring for sure. But I think that's a good question. That'd be like the main holdup of having it in help text.
Or if not help text, just putting the link next to it.
Just to let you all know, we need to make a decision or something because we have someone from the head office coming in at 12 or 12:30. So we need to decide for a break afterwards. And it's getting,
Yeah, we do have a break coming up, and maybe this is a natural point because to at least think about things, because it sounds like, okay, the previous page sounded pretty good. We're sort of getting stuck to how to put this extra information for each program next to it, next to the check box for the program itself. So we have to figure out how to format that. But and it sounds like we need to know if it's possible to have a clickable link in a pop-up information box. And it's hard to decide on anything without knowing that, I suppose.
I think that would be my question is, what are the other capabilities? Because if an assister is helping, those things might be helpful points to remember. But when we're working with families, and we're not doing this specifically, but the more information we're adding, if you're not receiving support, it's getting more confusing. Because now I have all this information. I don't know what I should apply for. Our understanding is through the system, it is supposed to help by answering certain questions, start to funnel you into the appropriate programs. And so there's a lot of times if I'm already going to apply, this just seems out of place if there is another place to go. But I don't know what the purpose was initially. I just wonder how it was informed.
I think, to me, I think the information need to come before the what are you applying for screen. Because I think once you get to what are you applying for, it's just, I think it's too much here. Because, and then they will try to get the information here, then they will click the link, and then while they are looking at the information, they will get kicked out of this one portal, right? And then they will have to come back and be like, right? So, I mean, I think that the information need to be coming before you decide what are you applying for. I don't know exactly where, but uh, the first page or maybe anyway before. And if we are going to keep it like this, second page together with the what are you applying for, I think we need to change some of the wordings here.
So
Okay.
let's go ahead and take our 10-minute break and ponder some of the orders here, and because later on, as George said, we do have a guest that I'm going to confirm she's going to be able to make it, and so why don't we see each other at 12:03 or 12:13 rather.
Okay, I'll see you back all at 12:13. Oh, yeah, okay, Maria. See you back at 12:13.
James,
Yes.
can I add something real quick?
Sure.
You want to take us off recording first?
Oh, Brandy, can you pause the recording? No. She might have
It's
stepped
okay.
away. Go
No
ahead.
biggie. um, just our our check-in meeting. I think I got two of those calendar reminders, but the dates were a little funny, so I just want to make sure I got it all in my calendar.
Yeah, I sent the series, but then in 2 months, I think I don't know, late in the year, there was a couple months where I had to move it a week, is what happened.
Okay, got it. Okay, I was wondering what those extra ones were. Okay, thank you.
Okay. George will be happy to know Keisha will indeed be here.
Okay, so she's here?
No, no, not yet. 12:30.
Okay.
So we do have some questions in front of us of how to proceed. And um, and we'll see if you know, like Andrew put in the chat a few different options. And I'm wondering if where people have landed on those three options. And NJ, you mentioned moving it to the original screen, and that's where I mean the motivation of all this in some ways started in our previous discussion, is since it was confusing to have those links separate from the checkboxes, you know, putting them on the same screen so people can see what they're applying for and not confuse clicking on the link for information to signing up for a program.
Is everybody back from their break?
It took me 3 clicks to turn on my camera. I don't know what's going on. Yeah.
Is Brandy's fixing Sydney, Vanessa, Susan? Are y'all back? Yep. Okay, Brandy's back. Okay. Guys, what we could do is, since if we haven't solved this problem, we can always put it, Andrew, is it too late to put it on January's meeting? Or do we need a decision now?
We don't need a decision now. I think maybe like a direction, if we're not going to be able to like come to a final decision on this today, like a direction for us to bring something more back to you next time. Like, do people feel better about it being all one section and having the help text or like the links to additional information rather, you know, underneath or next to the program request? And if that's a direction that folks want to go, I think we can come back next time with a proposal that looks more like that. If we truly don't know, then yeah, we'll just need to talk about it more next time. But if there's any sort of direction we can get to kind of guide the conversation in January.
Okay, so since this is going to be a long process and so many short period of time, how does people feel about putting this on January's meeting?
I think it was going to go there in any case.
Okay, I'm getting thumbs up on most of this. So Dion, can we put this on January's meeting?
You got it.
And Dion, can you give us the action item to check in with the developer to see if we can add links into help text?
Okay, thanks. I may come back to you for that verbiage, but I'll add it.
And could you give us some samples or examples in January's meeting so we can kind of get a better idea what we discussed?
Yes, you can give me that action item as well.
Sorry, Veronica.
No worries.
Okay. For next time, I like the idea to put links in the previous page to learn more about information about each. And that's from Maria, I think it was. Yeah.
Maria, I mean, part of I'm just going to do a tiny pushback in that part of the concern was people were thinking they were applying for the program when they were putting the links. And if we put it on the previous page, it feels like we go back to that.
Okay, got it.
But I mean, it's not, I don't want to shut it down, but I'm just wanted to point that out.
And is Miss Nikisha on?
No, not yet. We have another request we can talk about.
Okay. I don't have the agenda in front of me, so I don't know.
So let's see. Okay, but it sounds like we'll come back, explore whether it's links or information pop-ups for the links. We can come back next month for that. So in that case, I'll share my screen again, and we'll talk. I mean, we have what, 10 minutes or so before we run to our next thing here. And I guess maybe we can serve it as a reminder of what this one is about. We did talk about this a little bit, and I know Andrew has some more ideas of how to present this info.
Yeah, so last time when we talked about this, we came with like a really broad proposal and kind of asked a lot of everyone to like narrow it down into what we might do. So now we have a little bit more specific suggestions of what we might do with this. So we can kind of skip over all of this like possible suggestions section here, but real quick, just to like refresh everyone's memory, this is adding text on various screens, either whether that's help text on the document upload screens, things like that, of like, what qualifies as a medical expense, who can get a medical deduction through reporting medical expenses, and what type of verification is needed. We don't explain a lot of that. And as you can see, there's like a ton of information that goes into like determining all of that, but what could we do to put information on portal screens to help make that process easier for folks knowing when and what they should report in terms of medical expenses to get a medical deduction on their case. So some of the screens we're going to look at are the document upload screens, like miscellaneous document upload, the next step screens, which is a post-submission screen. It comes up after you've submitted the application. It's telling you kind of what's coming next, what might be needed. And then the expense gate post and expense summary screens. That's where you would actually report the medical expenses that you have. So I have, if we scroll down, I have some specific examples of what I think would maybe work. And this is small, so I don't know if we can zoom in real quick. So I think the challenge with the miscellaneous document upload screen, it's already a ton of information here, but to try and give a little bit more context about what could be uploaded here. So we have a pointed list here of different things that we need proof to see if you're eligible for. So before, medical cost was listed in here, but it just said, or no, sorry, not on this screen. Excuse me. Medical cost was not listed on this screen yet. So I have the proposal to just add this blurb here: proof of any medical costs you've reported on this application, such as receipts for medications and supplies, documentation from pharmacies, or notes/other contact from a medical provider. Proof should include the cost, frequency, and show that use is under the direction of a licensed medical professional. So that is like a blurb that I came up with from like, a real like page-long example of like what you can report and what needs to be provided as proof.
Andrew?
Yeah.
This is George.
Yeah, George.
I think you should also put up there copay also, because not many people would know. When you go in cost, you hear reported, so this application such as for medicines and supplies, documentation from pharmacies. Okay, I think that copay should be in here somewhere along with this, because so they could distinguish the difference between the cost and a copay. Because when you go to a medical doctor or to a pharmacy to get your medicine, you have to copay because the way the insurances are set up.
Mm-hmm. So maybe like uh, that first sentence or the first bit of the sentence could be like proof of any medical costs, deductibles, or copays.
Mm-hmm. Yeah. Yeah, because the copays you have to pay. Some people have to pay in order to get the product or medicine to cover for the medical costs before the insurance will even pay for what they're supposed to be paying.
Yeah, and I think I did list that more in some of the as we get along in the, like I organized this poorly. We should have looked at the expense summary and gatepost screens first because that's where the actual information would be reported. This is coming later in the application where you would be uploading kind of proof of what you had already reported on the application, but I still think there's room to expand here a little bit. I'm just typing it out real quick.
Yeah, because there's going to be a lot of people that's going to be scratching their head like, well, the difference between, does this mean copays too? They're going to think about, because that is part of cost.
Yeah, you're right.
Anyone else have opinions on some of this language suggestions?
Now's the time to speak up, guys.
I just put that maybe we can look at this later too, and because there's so much content here, maybe it'll be easier to kind of read through if it's broken into like has little breaks or sections. But
All we're really proposing on this page to update is what's in this red box here. All that other stuff is, I mean, if we want to look at this page in general of what it says, we can bring that back as another item. But really, what we're asking to review is just the block of text in the red square. And that red square isn't on the page. It's just to highlight what we're talking about right now.
Yes, yes. Andrew, were you going to show us that other page of where we can actually input those?
Yeah, let's continue on. Unless for now, James skip this next steps part.
Into the gatepost?
Yeah, into the gatepost here. So this is the full help text, and maybe you can scroll and just zoom in just a little bit more, if possible. Yeah. So this would be the full help text that we're proposing when someone is reporting medical expenses, and it's quite a bit of information. That's why I think it fits best in help text, which would be associated with that medical expenses the question mark next to that. And so it starts by explaining that telling the department about medical expenses could increase food benefits or reduce the amount you have to pay in long-term care services. You don't have to tell us about medical expenses, but if you don't report the costs or verify the costs when asked, they won't be used to figure out your benefits. It lists what the allowable costs could include. And in there, that's George where I was mentioning, it does mention deductibles and co-insurance. We could call that copays if that makes more sense.
It would.
Yeah. And then, yeah, after the allowable medical costs, it lists costs that are not allowed. And then a little blurb about what we look for in proof. And so you can see the text, the block of text we looked at before on the miscellaneous document upload screen, and it'll be similar once we get to reviewing the next steps as well. It's me trying to condense all of this information into like a chunk that doesn't make the page unbearably long, basically, to kind of remind folks of like, hey, this information you reported earlier, we need documentation of that.
We'll definitely need higher resolution screenshots too.
Yeah, I don't know what happened. Sorry. If on the briefing sheet too, this text is all like typed out as well. So I can pop that in the chat.
Yeah, it's on, I think it's the previous page.
I do have a question.
Mm-hmm.
Back that up and go where you were before.
Okay.
Okay, make that bigger. Where it reads medical expenses that are not allowed. Credit card debt related to medical expenses. Well, you could make, if you're going to put down credit card debt related to medical expenses, then you need to put it somewhere else where it's allowable on how you pay for your medical cost. Is it by cash, money order? Because there's a big difference. They're going to be asking, well, yeah, I pay my medical expenses, but if I can't do it on my credit card debt, how else can I claim it? Could I do it on cash or can I do it on a check? So that needs to be clear.
Yeah, I don't think it's saying that you can't claim medical costs that are paid for on a credit card. What it's saying is you can't come in and say, I've got $5,000 of debt on this credit card from medical expenses from last year that I'm not paying, that I don't have currently anymore. It's supposed to be about ongoing medical costs. So it can't be for old credit card debt to pay off your credit card debt. That would not count towards this. It needs to be for ongoing medical expenses.
And can that be defined a little differently or maybe a definition?
Yeah, I mean that we can look at a better way to say that for sure. That's not that's a little bit more clear.
Because this way it can go either way on this.
Mm-hmm.
Well, we have our guest with us.
Okay, good.
Director Keisha Knight-Coyle. And George, did you want to say a few words to introduce her?
Yes. Hi, guys. This is Nikisha. She is a really cool person to really talk to. Okay, Nikisha, I hand it over to you. She's from the Oregon Health and Human Service Director.
Thank you, George. Really good to see you and good to see you all. James, thank you so much for the invitation as well. As George said, my name is Dr. Nikisha Knight-Coyle, and I'm the Director of the Office of Aging and People with Disabilities. That's housed in the Oregon Department of Human Services. And I don't have an agenda with this discussion. I'm really hoping to get to know you all, the work that you're doing, see if there's any questions that you all may have for me, and take it from there. I would love to learn more about what this committee is doing and what the impact of your work is, and how I could support that. So James, I'm open to your ideas on how to
Yeah, well, you
we do
came
some
in as we were
introductions?
discussing how to clarify for people who are in the one system to is it give better examples of proof of medical expenses. So a lot of our work deals with adjusting the wording of the text that people see, because there's a lot of it. There's a lot of text. It's easy to get buried in it. And so how do we both simplify, clarify it, and keep it at a proper reading level, and also make sure we're not scaring people with it? I would say that is much of our work. Unfortunately, we have big ideas. It's not unfortunate we have big ideas in this committee, but it's unfortunate that it's difficult to get those big ideas in place, and I'm sure you are familiar with that.
Yeah.
But by changing wording, by changing maybe the order of things and adding information boxes, we can hopefully make this more accessible, this system more accessible to people. And we have a lot of wonderful medical assisters. We have benefit recipients as part of this group. We have well, Christy Reese, who just came on camera, who's our latest addition to the group with Back to Oregon. And people who work in childcare with troubled youth. And so the different parts of the state represented. So we get to meet here on Zoom once a month. And I'm sure many of you, your work has touched aging and people with disabilities. So there must be some, if not questions, some thoughts that people can share with the director.
I would love that. And I see that there's about 80, oh, there's 18 people.
Yes. Yeah, we're not that big.
Okay. I don't know, my mind went to like 88 people, but it's 18 of you all. Yeah, so I'm just really curious. And just so you know a little bit about me, I'm a transplant. I'm a native New Yorker. I've been in Oregon for 15 years, and I've been with the state for 15 years. And in my career, it has really crossed the lifespan. So I've worked in early care and education, right? And that's where actually James Barter and I originally met, is when I was in the former early learning division, right? And James Barter, we were colleagues in that space there. And so I'm actually intrigued by the breadth of representation here as well. I think it's important that we're thinking at all points about our work through that prism of lifespan, right? Because that gets us to a better level of quality. Oh, Christy, I see something from you. Okay, I see you going off camera. So yeah, I'm the director of aging and people with disabilities now, working on this part of the spectrum, but I've worked all the way through, including justice involved youth and people with mental and behavioral issues as well. I've done a lot across that spectrum. So
Back in
yeah.
my days as an advocate for children, we were on the home visiting
Yes.
committee together. Yep.
Yeah. Seems like a lifetime ago.
It does seem like that.
Seems like a lifetime ago.
Okay, guys, is there any questions you would like to ask Nikisha? April, Sydney, Vanessa?
Is this a quiet group?
Not
typically.
Is it? Okay.
Well, George helps keep everybody in line, but
yeah.
I suppose, one of the things maybe, Nikisha, as people are thinking about what to say, and please feel free, but how you see APD, aging people with disabilities partners, and the clients, how they see the ONE system. Are there things that you hear that that are frustrations or good things or whatever?
Yeah. Thank you for that. So I've traveled every year since I moved into this position. And again, I've been in this position now 3 years and a couple of months, 3 months. And every year I make my circuit around the state. And as you can imagine, the ONE system um, comes up often. And staff frustrations, concerns about our ability to effectively reach some of our consumers. And in our aging and people with disabilities system, we refer to the Oregonians that we serve as consumers because that's what they asked us to refer to them as. Just so you understand, when I say consumers, there's lots of different terms that can be used for that, but that's why I use that particular term. And that there's concerns, and so is it the one system or is it the processes around the one system that are creating the challenges? And I think from listening to those out in our local offices, it's a combination. And so what I've done is, I would bring information back after my travels to Nate and team um, to share. Also, while I'm out, I identify in certain areas who their representatives are. And I think it's for this group, right? That we have representatives across the state, or is it a different group? There is a quality improvement OEP group that convenes, that takes issues and then tries to address those issues. So I'm not sure what the relationship of that
There is a
group
worker
is.
group. There are workers from around the state also convene and discuss about situations and problems that they see from the worker lens.
Mm-hmm. Mm-hmm.
And so sometimes they'll get suggestions that come over here and vice versa.
Mm-hmm. So some of the things I hear about are some of the forms, the fonts on the forms, individuals being closed in the system before they've actually received services. And for our aging consumers, it's accessing services can sometimes be a matter of life and death, and it's not being melodramatic. When people when they reach out to receive services, they need those services at that moment. So when there are delays, again, either due to process or system constraints, that sometimes we lose people, before they can actually access the services. And so, yeah, it's a few things.
So, so what we do here also is we try to put things together which could be more simpler than it was before.
Mm-hmm.
Things better, to make things run smoother, to like the language, putting more different type of languages like Arabian and Russian and all that other stuff. I don't know if your crew has noticed, but the numbers kind of flex. We give suggestions and stuff to kind of help your department and other people's departments and how people fill out applications and that. And I think we're sort of I would consider us as more like family, working together as a team and making sure it's a pretty good one system.
Mm-hmm. So you all focus primarily on the system, or do you also work on the processes around that system?
Andrew, you want to answer that?
Yeah, it's mostly sorry, hi, I'm Andrew Demeray. I'm
Hi.
a business analyst. I work on the One Online portal with the One BA team. And yeah, our focus here is mostly on like system design and system functionality, not necessarily processes around that. So looking at what is working for people, what's not working for people, like pain points, things we've updated in the past are like looking at how income is added to a case. Is it easy to do that? Is there like, is the way that we display the information on screen intuitive for people to tell if they're like updating income correctly or if they're adding a duplicate record or something like that? So that's one thing we've looked at in the past. We also look at things like, I think James mentioned, like wording on screens. Is the way that we're explaining things understandable to everybody who's using the system? Is there better ways that we could explain that? Like, for example, when like uploading documents just to support the changes that they've reported on the case. Does that Like, are we explaining things in a way that are going to have people reporting the correct information so that their case is accurate, they're getting the benefits that they're eligible for, things like that. So yeah, and then really it's pretty broad in terms of like what can be brought to this committee. We have different suggestions that come in from all sorts of different sources, that people using the system, workers who are working on changes and stuff that are reported. They'll report things that they see that are kind of patterns that they're seeing on changes that come through the online portal. And then we bring that information back to the committee here and kind of discuss what's the best way to make changes and updates to the system. So yeah.
Okay. I would ask not just how like information is put in, but how information is received. For instance, like one change that was made was whether a family was connected or not connected to a provider when it comes to ERDC. Families were applying for the benefit, said, hey, I have it, my child's enrolled, but their provider is saying, I'm not getting paid, I'm not getting paid. So instead of having those long wait times, they can log into the system and see whether or not they are connected, which allows families to continue to access and providers are being paid. I believe it's just making the system overall much more accessible to Oregonians overall. As we know, sometimes programs get rolled out, we use big words and we say this makes sense, but we see the implementation on the other end. So we're helping reduce call times, but also make things easier for families to either access a program or just see the status. I believe another change we made was when they're uploading documents, when I'm uploading my pay stubs, is this for SNAP? Is this for ERDC? Is this for medical? So hopefully reducing eligibility workers' call times to allow them more time to really focus on those harder cases. But maybe I'm just making that up. Who knows?
No, I love that. And that does make me curious with our consumers that are aging, our seniors and elders. A lot of times the challenges that I'm hearing are they receive forms, but they either can't read them or there's some understanding challenges there. And this is why I was trying to ask, like, between the system and the function, like the process around it. Um, and the way that, but pre-one, we would go out and help. So our case managers would go out, our eligibility folks would actually go out physically, sit with um, families and individuals and walk them through and gather the information in that way. And through the system, it's been a little challenging, for some of our consumers again to understand, So when I actually met one of our consumers who lives at home, is independent, and was like, "Oh yeah, I received about 5 notices. I haven't opened them. I haven't responded to them." And so it's how do we ensure that our systems are also responsive to what's presented, by the different populations that we're trying to reach. And that's going to require a different approaches, right? To doing that. And with our consumers, there's a lot more one-on-one that has to happen with that. So
I think maybe our ask to help support that is if you could get, because this is, from my understanding, opening to anyone, whether you're a client, whether you're an administrator or supporting, is getting this group open to others, because we can all feel like this is going to be great, but it takes that additional person's like, actually, this is what this is going to look like. So maybe getting your support as in really marketing this group to other folks and your clients, because the more the merrier really in this group, because like I said, sometimes we're all subscribed to the same idea and it takes that one person to be like, actually no, to ensure that the changes and work we're doing is actually, we're encompassing all of Oregon, not these certain groups.
I would be happy to do that. I could send out a notification probably later on this week about you
Or
all. So if you
like,
all have any information like that and how they can, get in touch and what that piece looks like, I would be happy to do that.
I think that, and if you have any departments beneath you that are saying, hey, we keep running into this, because sometimes we have nothing to work on. I'm going to say it. Well, like we need new things to work on or bigger things, right? And system's not perfect. So getting your teams to really tell us like, hey, this is a common theme we're seeing where folks are either ending the application or stopping, or we don't know where to go from here.
Okay, no, definitely. Thank you for that.
Yeah, just to kind of tack on a little bit more, I think that you were asking about the difference between like process and system updates and things like that. And I think a lot of what we try to get at is like trying to eliminate having their need for additional processes. Like you were mentioning, having to go out in the community and like go one-on-one with an individual to help explain things. And I know that like certain individuals, that's like the level of help that they're going to require to like get the understanding of their situation and their benefits and things like that. But it also exists populations who, if we give them the right tools and the right updates to our system, that they can self-service and get that information that they need and have a better understanding. So like what can we do systematically to like update our system to make it, as Vanessa was saying, more accessible to everybody or to a wider group of people, so that we can try to eliminate some of that extra process for folks who can self-service and get that information they need, whether that's finding a notice or understanding a notice through the online portal, rather than needing to kind of like, contact us and say like, I've got all 5 of these paper notices here. I don't know what to do with them. I need someone to help me explain that. How do we break that information down in a more accessible way through system updates?
No, I think that's
Veronica, would you like to tell Nikisha what your job is? And she's part of James's crew.
Okay.
Sure, yeah. Hello, my name is Veronica Kritsky. I actually work with Andrew, so he is the 1BA for the online portal, the applicant portal website, and I'm the business analyst for the Oregon One mobile app. So
okay,
the app side of it. And I've been in this position since March of this year. So yeah, that's what I do. To add to kind of what James and Andrew already explained, this committee can do more than just verbiage updates or screen flow updates. We've recently worked on a bigger project that was submitted as a request to this group, and that was to add a self-scheduling option to our One Online portal and the mobile app. So improvement requests don't have to be as small as like verbiage change. It could be anything big and crazy. As long as it's possible, we will take it on.
Sounds great. Nice to meet you, Veronica.
Yep, you too.
And then there's Paul and Dion. Dion, say hi to Nikisha.
Oh yes, Dion. I we have interacted before.
Yeah. Hi, Nikisha. Good to see you. Sorry I'm off camera. I'm just still a little under the weather.
It's okay. It's okay.
Maria, were you going to say something?
Yes. Hi, Nikisha. I wanted to introduce myself since I'm the co-chair. We really appreciate you joining us today and for your support. And I just kind of also want to share that we are like a voice for our Asian, our AHSE OHP certified assisters and our Asian community members utilizing and navigating the ONE system. And I'm the senior program manager at Asian Health and Service Center, co-chair here with George. And at AHSE, well, I think you said you want to learn about us too. So we serve mostly the Tri-County area and the Asian community members of all ages throughout the state. And we recently celebrated our 42nd anniversary. We have bilingual, multicultural staff who speak Korean, Vietnamese, Mandarin, and Cantonese. And we have many different programs, including the Asian People Disability programs. We have programs through the Multnomah and Washington County, APD or ADVS like INR, case management, transportation, nutrition, and family caregiver programs, which I'm sure you're very familiar with.
Yeah.
And we also provide enrollment and health system navigation support for like OHP and marketplace reproductive health programs. And I just want to say I'm truly grateful to be part of this committee, to have this opportunity to provide feedback and to continue to improve the ONE system and the process navigating for our community members. Thank you.
That's wonderful. Thank you, Maria, and really nice to meet you as well.
Thank you.
And I think, I think I'm not sure who said it, but that you all are not always utilized to your capacity, and which means there's lots of opportunities here, right? So I'm going to commit to sending out information about, you about you all and the work that you're doing. It would be helpful to get something in writing from you all that I can share.
We have a
And I can
flyer
share
that
the
we had
link.
been working on, and yeah.
Yeah, that would be great. And let's just see where we can go. I'm sorry, I have bells and ducks and everything going off here.
And we kept you longer than I promised too, so sorry about that.
No, I was trying to trying to discreetly turn off my my bells and my ducks and everything. And but yeah. So I'll just look forward to that. And I know, as things evolve and as, feel free to invite me back. Or if there's an aspect of our work that you're interested in, with regards to, for example, OEP and APD, financial eligibility, some of those pieces, like feel free, or eligibility in general, just let me know. And I can bring in some of my team members to help with some of that as well.
We may take you up on that. Yeah, as you see, you've only met a few of the people here. It's a great group, a great set of staff that makes this possible. But Vanessa, Maria, and George, and everyone else who just bring a lot of their experience and knowledge to help make the system better.
Okay, April, Paul, Andrea, Susan, Brandy, Arthur, you want to say anything to Nakisha? We've got about 5 more minutes.
Thank you for being here, Nikisha. I'm April Paul. I work for Neighbor Impact Childcare Resources over in Central Oregon with Sydney, where I manage the Baby Promise program. And Sydney is the incredible person who coordinates all of our enrollment with our families. So we're participating in the ONE system with a very limited view in order to help our families and confirm eligibility so they can enroll in our program.
So Baby Promise, is that an offshoot of Preschool Promise?
It is
Or is that
an
something
offshoot of not preschool promise, ERDC. So we utilize the
the
same
ERDC?
funding
Okay, gotcha. Yep.
as ERDC, yeah, and all of our families are duly enrolled. It just sounds like preschool promise, but we offer full-time, full day, full year childcare to ERDC families with infants and toddlers in contracted slots.
Wow.
Yeah.
Thank you. It's good to meet you.
Yeah, you too. And Vanessa also
I know
does that
Delk
same
does like
job.
that promise.
Yeah, we are at the South Coast. We have the beauty of we enroll for Preschool Promise and for Baby Promise as well. We're the only hub that does both.
Okay.
And we also enroll like district slots. So we're really trying to make that coordinated enrollment work. If it is successful, we do it right, but it just takes relationships, right?
Of course. Yeah. And that's like the the promise, if you will, of the OEP system. I don't even feel like we've hit like the tip of the iceberg of what we can do collectively, when we really reach a different level of maturity, right? So,
Hey, Susan, Indra, anything you want to say? Ninja? No? Susan?
I work with the community health centers of Wayne County. And it's just been really hard doing eligibility for people who were going through the redetermination after the pandemic and so many people losing OHP. Just and not understanding like why turning 65 or getting Medicare makes them rich now, even if they make the same money. And so it's just been really difficult and just it would be nice if there was a way if people can keep OHP as they turn 65 or have the same income guidelines as Magi people. Because nothing's changed. They're making the same amount of money, but now all of a sudden they're too make too much money.
Yeah. Yeah.
Hey, Brandy Arthur.
Hi, my name is Brandy Arthur. I'm OS2 in Central Office for OEP, and I'm just really excited that you're here. And thank you so much for taking the time to speak with us.
Thank you. Good to meet you. We've
Yeah.
probably seen each other around, depending on how long you've been around. So,
Oh, I'm brand new.
okay. So
Yeah, but
yeah,
I'm sure we will.
we will. No, we will. I pop up there every now and again.
And Paul, do you want to say something?
Sure. Hi, Nikisha. My name is Paul Alderson. I'm public services representative for the applicant portal technical team. So when there's things that pop up as far as the technical team, I'm on the ground floor. So usually, if it's happening to the team, I usually have experienced it at least once or twice. So I just bring my knowledge to that to help the team as much as I can.
Mm-hmm. Well, nice to meet you.
It's very nice to meet you too.
And I know we're at hour here, and I just want to thank you all for your time today. And on a different level, I just want to thank you all for being a part of how we serve Oregonians. And so a lot of us are in this work because it aligns with our personal missions, right? Of service or whatever that thing is. And I just want to say a lot of times we don't get thanked for the work. You get called to the carpet when things don't go well, but we're not thanked. And so I just wanted to thank you all for what you're doing, both in your jobs and in this specific committee. So, and again, let's just stay in touch. Feel free to invite me back. And yeah.
Well,
We'll
thank
keep
you for
working
coming
toward,
too. Yeah, absolutely. And we will take you up on your coming back and getting the word out. I'll get you some information. You can see we have a great group here. But yeah, I think we should probably also close out our meeting since we're beyond time.
James?
Yeah, George.
Nikisha, there's one other person that is not on here, and I'm sure you'll come across her sooner or later. Her name's Samantha. She's a really cool person. She's on James's team. I think she's working on another project, right, Andrew?
I think she's just out of office for a couple hours today. But yeah, Sam is
Sam
she
Brookshire.
is Samantha Brookshire. She's the lead worker for both Veronica and myself. And so yeah, she often participates in this meeting as well.
Okay. And before anybody runs off, James, are we done with the agenda?
Well, you guys all got out of talking about our charter, but we'll come back to that next month. So thank you for all your work today.
Okay, so before we all leave, I want to wish everybody a Merry Christmas and Happy New Year's. I will all see you in January.
And remember, we have a new start time come January at 10:30.
Yeah, and you all be safe and wish good stuff with all of your guys' families. I'm going to be over at my mom's house on Christmas, so that would be part of my family get together.
Right.
Thank you, George.
Thanks, George.
Thank you. Bye.
Thanks, everybody.
I was
Merry Christmas.